Okay, we're going to talk about Labatalol. Oop, wrong color. Or Trandate. Or Normadine or Normdine. I've never seen it by these other two names. Labatalol is what I know this by. Okay? Labatalol, it's a lol. So it's got an A here instead of an O, but it's a lol. What does that tell us? That tells us that it is a class 2 antiarrhythmic also beta blocker. So what's the action? This one lowers the blood pressure. Oop. Lowers blood pressure through non-selective blockage blockage of weird-looking B receptors, of beta receptors. Okay, what does that mean? Okay, so it is a non-selective beta blocker, so it's not going to select between beta 1 beta 2, it's just going to block beta. It does have a limited blockade of alpha 2 receptors, but that's not what we're using it for. We're using it for its non-selective blockage of beta receptors. Okay, Labatalol works well. It is a fairly effective antihypertensive. Okay, so let's go ahead and add this real quick. Parentheses and limited blockade of alpha, weird looking A, 1, alpha 1 receptors. Why are we given this? Well, what's its action? This one is not a rate controller. This one is a blood pressure controller. So we're going to give this in a hypertensive emergencies. Hypertensive emergencies. Hypertensive emergency. What does that mean? That means their blood pressure is elevated to the point that they are causing issues. If they have stroke-like symptoms already, if they have developed any of this stuff already, you're probably going to be contraindicated. Just due to you don't want to necessarily treat the blood pressure of a stroke because maybe that's tamponading a bleed. We don't know. We can't tell what the stroke is, so we want to be careful. However, we also want to be proactive for our patients, so follow your standing orders. Whatever they dictate out as a hypertensive emergency worthy of giving Labatalol by standing order, follow those guidelines. If you do not have those guidelines or it's a call-in order, then obviously you're going to call into your medical direction and follow their guidance. Okay? So, with that being said, if we're having a hypertensive emergency and we're talking, probably in the 210s over 150s, 160s, I believe is the local guidelines, or was the local guidelines. And then you're going to move on to your orders. You're going to expect to either see or hear orders for 10 to 20 milligrams. 10 to 20 milligrams. It's not weight-based. It's not titrate to effect. It's a straight dose. It's a straight given dose that's given whenever needed. Okay, and by that, we're going to give it by IV, IO if we have it, or have to go that route. And they can also take this by mouth, so it is available PO in pill form. So this is a beta blocker. What are we not going to want to do, or who are the people that we are not going to want to give this to? Again, just like the last one, esmolol, it's a beta blocker as well, however, it controlled rate. This one controls pressure. So our contraindications are going to be asthma, heart block, bradycardia, cardiogenic shock, and what did we talk about before? If they're on other IV blockers, beta blockers, or calcium channel blockers. If you're ordered to give this to a patient that is already receiving calcium channel blockers, or they're already receiving another beta blocker, that would be worthwhile to inquire with the physician ordering the med to find out what they truly want, or if they remember, or if they were aware that they were already currently on a blocker. Review your order first and make sure that it doesn't say stop current infusing medication and then start this one, just to save yourself a little embarrassment. Always double check your order first. Anyway, so we're going to add in IV calcium channel blocker to a contraindication. Our adverse effects again: bradycardia, hypotension, congestive heart failure, and lethargy. While this one acts differently, it is also going to act the same as other luls or lullals, in that it will cause a bradycardia as well. It also does control through rate. And also, this one is a non-selective beta, so it's not just a rate controller. It works very well for bringing down hypertensive crises.